Welcome back to my channel, Running in Rehab. My name is Brett. I'm a 234 marathoner and I'm a third year physical therapy student. Today, we are going to talk about pain when you're running. It's almost inevitable that you're going to run into some legitimate pain when you're running. Okay, I'm not just talking about pain as in muscle fatigue, that good kind of pain when you're going on a hard effort. I'm talking about actual joint pain, shooting pain, shin splints, hip pain, joint pain. Okay, so make sure you guys can differentiate between joint pain and muscular fatigue, because the joint pain, you really want to take a step back and evaluate your body and your form. Now, in physical therapy, you got to look at the body as an entire system. Okay, so pain at your knee may be stemming from an ankle stiffness or an ankle weakness. It could also be stemming from a hip weakness or a core weakness. Now, if when you're running, you got to look at your posture as well. Okay, so if you run with an increased curve in your lumbar spine, we call this excessive lordosis of the lumbar spine. That may indicate that your abs might be a little bit weak. Okay, so maybe that could be something for you to consider. Let's say if you're having hip pain, it may be a core issue. You want to test your hip musculature as well, right? Because the hip kind of has a rotator cuff, muscles that keep the hip stable when you're running. Take a look at those muscles through some rotational exercises of the hip. Similar to the shoulder, they're both ball and socket joints. Similar to rotator cuff exercises of your shoulder. Take a look at your hip abductors, the muscles that move your hip away, your leg away from your midline. Those are your hip abductors. They keep the hip stable and your pelvis stable. So look at the stability of your hip. Try to assess, is it a stability issue of my hip that my hip is hurting? Because it could also be a tightness issue. So in physical therapy, we also, we assess your mobility and as well as your strength. So if your mobility is very limited, a lot of the times with tight hips, we see issues at the knee and the back, because there's a compensation where another joint needs to be more mobile. If adjacent joints must compensate to be more mobile if an adjacent joint is tight. Okay, so take a look at your hip. Is it tight going in? Like can you internally rotate a lot? Maybe that feels tight. Maybe stretch your hip into internal rotation. Again, make sure it's super pain-free and just a stretch. If you stretch it into external, right, moving your knee out, moving your hip out, is that tight? So look at the stiffness of your hips, right, guys? This is going to be very general, but look at the stiffness of your hips. Look at the stability of your hips. Do you feel more stable on one side as opposed to the other side doesn't feel as stable? Like if you balance on one leg, is your posture leaning forward when you balance on one leg? Because we got to take a look at your posture and your form. And your form, you want to make sure your foot is landing right under your center of mass. And you're not overstriding. As we work our way down to the knee, again, you want to assess the hips like we just talked about if you're having knee pain as well. But at the knee, is the pain on the outside or lateral, or is it medial on the inside? Look at those structures. Are you tight on the outer muscles? Like, is your IT band tight? Maybe that's something that you may need to stretch. Again, guys, super general information here, but things that you can kind of test out to hopefully avoid injury and just get a better understanding of yourself and where you're at. Is your hamstring on the inside, right? You got on the back of your leg, you got hamstrings going down both sides. A lot of the times we see that medial or inside hamstring getting tight. That could be a function of your glutes not helping, because the glute max and the hamstrings do hip extension. So maybe that hamstring's overworking for the glute not being as strong. So test your glute out, right? If you just lie on your stomach and raise your leg up and try to squeeze your glute. Do you feel your glute firing? Maybe yes, maybe not. Is one side weaker than the other? Again, test those hip abductors where you lie on your side, raise your leg away from your midline, test those hip abductors. As we work our way down to the ankle, ankle is super important. The foot and ankle is super, super important, and I think it gets overlooked by runners and by physical therapists. But super important to look at the ankle, because if the ankle is weak, that can cause ankle pain, that can cause shin splints. The big muscle that you want to look at is the posterior tibialis. And if you're looking at the back of your heels, and if you do a raise up on your toes and you come back down and your heel kind of dips inward into pronation, or dips your heel, right? These are my feet, and I go up and my heel's kind of dipping inward quickly and not very controlled. Or if you just tend to pronate, right, your feet flatten a lot, take a look at strengthening your posterior tibialis. This can be done doing a calf raise, but squeeze a ball between your heels, okay? And look into some other posterior tib exercises. I've seen so many times with runners, it's the posterior tib that's weak or posterior tib that's painful, and because during running, that muscle has to work pretty aggressively throughout your whole run. So take a look at that. And then another thing to look at for the ankle, again, guys, you want to look at mobility. So are you supinated, right? Do you have high arches? And maybe you have an issue pronating, right? Maybe you're unable to pronate, and maybe that's something you need to work on. That's something I need to work on, especially on my right side. I did have an ankle surgery there, so I've been stiff there. But so something I really work on my slant board, right, and just on the floor, you can get into a squat position and just kind of flatten that arch down, right? Because if we're tight there, guess what's limited? A motion called dorsiflexion. And dorsiflexion is when your toes come up towards your knee. Super important to have at least 10 degrees, let's say. Ideally, more dorsiflexion. Especially if you guys are getting into minimalist shoes, right? Those zero drop shoes. The Achilles can become really stressed if you can't get into that dorsiflexion. And if we can't pronate all the way, right? We have that super rigid foot, and we can't flatten the foot too well, or as well as the other side. You can see how that can cause an imbalance, right? That can cause hip pain. That can cause back or sacroiliac SI joint pain. Can cause knee pain, right? So that's why the foot and ankle is so important. It can cause ankle pain. The feet can cause issues up the chain all the way up to the lumbar spine. So somebody that comes in with SI joint pain, potentially the physical therapist should be looking at the feet, right? Because if whatever's going on at the feet, definitely, there are compensations that must be made up the chain during your walking, or your running, or your standing, right? Especially in today's day and age where we wear shoes that are too tight, they're squeezing our toes aren't able to splay out and keep us balanced. Again, now we require more stability up the chain, right? The hips are working extra hard, the knee, the back, and if you overload one of those joints too much, pain. When the problem may be your feet. So I know I ran through a lot here, guys, but I hope this helps. I'm here to help. I'm a runner. So I constantly think about this stuff and try it out on myself and my own clients. And I'm here just continuing to learn just like you guys. So let's learn together. and let's help each other out. Let's stay pain-free during our running. Our running should help increase our health, our longevity, and our overall happiness. And injuries can really can hinder that. Can really hinder that. So listen to your body. If you're getting sharp shooting pain, take a step back, assess your body. Right? Look for these generalizations. Try to implement some strength training or mobility work that may fix these impairments or imbalances and get you back out there running. I hope this helps. I hope to see you guys on the next one. And as always, take care.